Did you know that 1 in 3 women are projected to have an abortion in her lifetime, according to the ACLU? Now, depending on what side you're on, that either gives you great hope or great sorrow. Today I will explain what is an abortion, what a successful procedure looks like, and also the effects it has on women's health and our population. As a woman in the USA, I am told that abortions are necessary and that they are my choice because it is my body and my choice. But I will go in depth further in what exactly we are saying. So, according to Merriam-Webster, abortion is the termination of a pregnancy after, accompanied by, resulting in the death of the fetus. When do abortions occur? Abortions occur up to 28 weeks and sometimes even up to 39 in some states. Why do women choose to have abortions? Well, one may choose to have one because she's been sexually assaulted and has become pregnant. Maybe it affects her health, or maybe she's just not ready to become a parent. I will show you a 2018 survey from Florida on why women chose to have abortions. So we went into depth into what is an abortion. Next, I will speak about a successful procedure and what that looks like. I will specifically be talking about a D&E, which is dilation and evacuation, which happens at 16 weeks or later. So it normally starts with a doctor dilating the cervix with a tool. Then a numbing medication is inserted in the cervix, and then a suction tube is inserted to remove the tissue from the lining. Afterward, forceps and a curette are used to pull apart and scrape away the fetus. Then, a tube will be inserted again and section away all remaining pieces. Then a doctor will go into a separate room to account for all the parts such as arms, legs, head, and spine. Afterwards, the patient will then be given medication to prevent further infection. So the CDC says that 99% of abortions are successful, but let's see what happens off the table. Women who have abortions have a 6% lower rate of fertility. So what does that look like? The women who have 6% lower fertility, that would end up being 6 out of 100 women, 1,200 out of 20,000 women, or 52,450 women just out of the city of Fort Worth. Also, women who have abortions are more likely to be entered into the hospital due to psychiatric reasons. Here is a chart that shows those stats. So not only does it affect women's health badly, but let's see what it looks like in the population. The CDC claims that 47.5 million abortions have happened, legal abortions that is, since 1970 and 2015. Out of the 321 million US citizens, that would be as if 14% of us were terminated. The numbers look a lot different then. Also, it is statistically proven that the minority populations have more abortions than non-minority, starting with African American, then Hispanic, Asian, and white. According to a 2016 survey in New York, more African American babies were aborted than born that year. So, out of 47,718, 49% of the babies were aborted. That equals out 23,281 aborted to the 22,427 born that year. 64 babies aborted to 61 born per day, and 6 babies aborted to 5 babies born per hour. So we've learned what is an abortion, what a procedure looks like, and the effects it has on women's health and our population. Today I just ask that you look at all the facts and that we choose our choices more carefully for not just us, but for those who come after us as well. Thank you.